Hello, Chicago, and welcome to Community Post, our CAN TV nonprofit community show. We are here to spread awareness. Well, today we are so fortunate as a Foxglove Alliance, Academy of Medical Surgical Nursing, and Hectone Nurses. We are so fortunate to have Miss Virginia Castañeda in the office with us. We are excited because we are celebrating Women's History Month, and we have a young lady here who's making history right here in the city of Chicago. Chicago, you guys are ready for a treat. So I'm going to have Mrs. Virginia introduce herself, and we are going to jump right in to learn all about the history that she is making.
Yes, thank you for having me here today. Like you said, my name is Virginia Castañeda. I'm the manager of Food Protection Services for the Chicago Department of Public Health.
Wow. I am so interested to learn about your story. Like, how did you get into food inspection?
Yes, so right out of college, I graduated from the University of Illinois at Chicago with a bachelor's in biological sciences. And I needed a job right out of college, right?
Yes.
So I started in a food company as a quality assurance, and that's how I got introduced to the world of food safety. I then came across a job posting for the city of Chicago for the Sanitarian 2 position, and that's what I did for 5 years. And there I learned to be passionate about food safety.
Yes. I'm a foodie, so I can appreciate that for sure.
And then I passed my exam as an environmental health practitioner for the state of Illinois, and that is a requirement to be a supervising sanitarian at the Chicago Department of Public Health, and I did that for 5 years. And then the opportunity came, and I was selected as the Chief Sanitarian for the Chicago Department of Public Health. So I'm proud to be the first Latina Chief Sanitarian for the Health Department.
Yes, I love it. Congratulations.
Thank you. And I'm currently the manager of food protection for the Chicago Department of Public Health. Again, the first Latina in this role.
I love it. Thank you, and thank you for your dedication. You know, it just highlights your perseverance, starting at one role and then taking advantage of the opportunities that have presented themselves.
Yes.
Now, with food sanitation, and you talked about all the different, promotions that you received and applying. Can you tell us just a little bit about your responsibility and your oversight at the Chicago Department of Public Health?
Yes. I manage and oversee the food protection program at the Chicago Department of Public Health, which is the third largest health department in the country.
Wow.
I oversee that the inspections, the food safety and sanitation inspections at food establishments are conducted effectively, and that we're enforcing the municipal ordinance and the food code rules. I collaborate with the Chief Sanitarian, our current Chief Sanitarian, our supervising sanitarians on any field-related matters. But I do more than food safety. I also oversee the body art and tanning programs for the Chicago Department of Public Health, which includes inspections of tattoo and body piercing establishments.
Okay, 2 different spectrums,
yes.
But let's pull it all together.
Yes.
Oh my gosh, wow. And that's something that I learned today. I didn't know you did that. Wow.
Yes, and we also oversee swimming pool and spa inspections in the city of Chicago. But for this season, we're coordinating with the Illinois Department of Public Health. Based on our capacity, they're assisting with those inspections for this season.
Wow. I am thoroughly impressed. What is it that Virginia does not do? And that's what we're celebrating, like Women's History Month. Like, we are here, we are making a meaningful impact. This is just amazing. So my next question, with everything that you oversee, what is a typical day, or can you even describe a typical day?
I have no typical day.
I figured as much.
No 2 days are the same, and that's why I enjoy this job.
Yes.
And because it's not boring.
Yeah.
So I have to be flexible and adjust my schedule and my plans based on emergent situations.
Sounds just like me as a nurse, that's definitely like transferable. Like it's definitely the same thing. No one day is the same.
Yes.
It's almost a thing like you never know what it is you're going to get in
Right.
that day.
But good thing I've done those roles before.
Yes.
So I'm able
true.
to properly guide and provide the best guidance to my team.
Yes, I love that. And when you speak about your team, how big is your team? How many people do you oversee?
Currently, our team is 51 staff, diverse staff from office staff to field staff.
Wow, amazing. Learning a lot about the Chicago Department of Public Health. I guess for our audience, and I'm sure they have like plenty of questions as we talk about like food safety. Mm-hmm. How do we know if a restaurant is safe? As I mentioned before, I'm a foodie, so if I see it, on social media or people talking about it, I'm gonna go and check it out. But how do we know that restaurant is safe?
Yes, so the public, there's two ways, okay? The public could check the inspection records online at the City of Chicago's website. They could use that as a reference and make an informed decision. Or if you're at the facility, in the City of Chicago, you could look for the summary report. So the summary report tells you if they've passed and they've been in substantial compliance, or if they had some violations, they'll have a different summary report, and it'll list the violations and whether or not they've corrected the inspections during the inspection. And there's a little check mark that says whether they failed or whether they had a conditional pass, meaning they corrected the violations. Okay. So we want them to correct the violations.
We definitely do. I definitely do.
But I want to remind the public that the inspections is a snapshot in time, okay? So the inspector is there from 1 to about 3 hours, depending on the size of the facility, the complexity of the food preparation, and whether or not there's violations at that time. So they could be having a good day or a bad day on that day.
Makes sense.
And a facility could fail. I don't want people to say, oh, that restaurant or that facility failed, I'm not going to eat there. But they could fail for other reasons, such as overflowing garbage outside, because that could attract rodents.
Yeah,
that could attract rodents. But inside, they're properly handling the food. So that's why I refer people, go to the city's website, check the last inspection report, and you make a decision. Do I feel safe eating there or not?
Yes, I like that. Informed decision. And that summary report, when we go to the restaurant, where is that summary report located?
Yes, the summary report has to be posted visible to the public. I have a sample here in case we need to post it for later.
Okay.
So it has to be posted and visible to the public.
Okay, good. So Chicago, now you guys know. Can you talk about like the types and then the frequency of inspections?
Yes. So we have over 16,000 food establishments in our database.
Oh boy. Wow.
Okay. So there's different, people think we just do restaurants, but we do more than restaurants, okay? We do all types of food establishments such as grocery stores, coffee shops, food halls, schools, daycares, nursing homes, anywhere where food is produced, food trucks, and now that summer's right around the corner, the summer festivals, because there's food vendors there.
Yes. I mean, it makes sense, but we don't think about those things. You think about like the restaurants, like you mentioned, that's the first thing that I thought about. But the nursing homes, the schools, the food trucks, and of course, Chicago's favorite, the summer festivals.
Yes.
So thank you for highlighting that.
And we also do a variety of types of inspections. So we do our routine inspections, and we prioritize on the Category 1 facilities, which those do extensive handling of food. And then we do our complaint-based inspections. That's when the community calls 311, reporting a complaint or unsanitary condition of a food establishment. So for example, last year we did over 2,600 of those last year. We also do license type inspections for new businesses that are trying to operate in the city of Chicago. We also investigate suspect food poisoning inspections and our re-inspections for those facilities that do not pass their inspection.
You guys have a lot on your agenda, and thank Chicago. Well, we just need to give them a round of applause for the 51 and everyone that is helping make sure that we are safe in the city of Chicago. I guess, speaking to our audience, I'm sure they're asking how can they help, right? What are some of the ways that, one, we as healthcare providers, but also we as a general public, how can we help?
Yes, so business owners can help us by being ready for an unannounced inspection, okay? So they could focus on the risk factors that lead to foodborne illnesses. So keeping the food at the proper temperature, making sure that the equipment is sanitized, making sure that the employees, if they're sick, they don't come to work. They practice proper hygienic practices.
Oh, yes.
That they wash their hands
yes.
prior to preparing food. So that's how businesses can help us. The community can help us by reporting any unsanitary conditions in food establishments by calling 311. And we'll prioritize those inspections in those communities when the public reaches out to us, because they're in the community, they see the violations.
Yes.
But just because they call it, when the inspector is there, they may or may not see the violation during that inspection. Also, the way they could help us is engagement with the community. So if there's any chambers of commerce, we would like to partner with them.
Key point, yes.
And explain the regulations of the city of Chicago, because we have a common goal, right? Mm-hmm. To keep the public safe. They want to keep their customers safe, and we want to ensure that the public is safe as well when they're eating the food.
Yes, indeed. And then what about us as healthcare providers? The Academy of Medical Surgical Nursing and Head Turn Nursing, our goal, of course, is to increase the knowledge and the awareness across the city of Chicago. We mentioned hand washing, but what are other ways that we could help?
Right now, that is the only way I could think of how the nurses could assist us, by continuing to promote hand washing. That is fundamental,
I think
right?
we do a really good job of that, for sure.
Yes, there's no substitute for hand washing, right? It's not only in food safety, but I'm sure in preventing other illnesses.
Absolutely, absolutely. And then also, you mentioned the foodborne illnesses. From healthcare provider, we of course could share like the symptoms and get to the hospital, all of those things. Let's see. As I said before, you are a history maker when you were appointed as the first Latina chief inspector. How does that designation impact you? And then how will you inspire others to say yes to opportunities? Because essentially that's what you've done. You've said yes to opportunities to continue to feed into your passion and to level up yourself.
Yes, so this makes me very proud.
Yes. I am proud for you and proud of you.
And to be able to represent my community. So my parents immigrated from Mexico, and they're hardworking, and that's how I learned my strong work ethic. Okay, I'm a graduate of the Chicago public school system, raised in the back of the yards neighborhood, and I hope to inspire others. Because Latinos, there's not too many Latinos or Latinas in the field of food safety and public health. So I hope to inspire others, not only Latinas or Latinos, but others to explore this career, because it's very rewarding.
Yes. As I mentioned earlier, when you think about like food inspection, and when I first met you and started talking to you, I didn't even really know a lot about it, but to learn, one, we know how valuable it is, but I've just learned so much about it. And again, very proud of you and everything that you're doing across the city of Chicago. Have a couple more questions for you. What are 2 or 3 takeaways you want to leave with our audience?
Yes, so food safety affects the entire population.
Yes.
Okay, because everyone eats.
Yeah, for sure.
So I want to continue to build awareness of this field. Also, if there's any students interested in food safety and public health, they can connect with me. I've done some career days at some Chicago public schools. So if there's any organizations that want us to come and speak, we can come and provide them the information. I also want to thank my entire staff, the food protection and health code team, because with their work, they protect the health of not only residents of the city of Chicago, as well as the tourists in the city of Chicago. And with their efforts, I'm able to do my job successfully.
Yes, and you're definitely doing that. And I personally feel like secure knowing that Virginia is leading this. Now, Virginia, I know that you mentioned like your parents inspired you. Who else from history, but also personally, inspires you?
From history?
Yeah.
Okay. Well, the person that's inspired me, it's not from history, is my mother and my parents, basically.
Yes.
They've inspired me. Because like I stated, they came, they immigrated, and they've been hardworking in this country, and I'm a first generation college graduate. Okay.
Yes.
So they're very proud, and I'm proud to accomplish that as well.
Yes. And is there anyone in the field of food inspection who inspires you?
Anyone in the field? Currently, our previous managers, they were all women.
Yes.
So since I've been here, they're the ones that gave me the opportunity.
Absolutely.
So the previous managers at Food Protection have been women, so they've inspired me, and I've continued their role. Actually, I'm the second person that has worked our way from being the sanitarian to supervising sanitarian to chief sanitarian and manager. So the first person was Sandra Alfred. So, and I'm the second person that have followed those steps.
Yes, so I love that you highlighted how all of the previous managers were women. Again, we're celebrating Women's History Month, so we just wanted to highlight the women that are doing really great things. Yes, and I'm sure during our conversation we have inspired someone across the city of Chicago. I know that they could reach out to you. Is there any resource that they could go to learn about more on their own independently about food inspection?
Yes, so there's the Illinois Environmental Health Association, which also has information on food safety. But this field is more than food safety.
Yes.
So they could visit the National Environmental Health Association and learn more about food safety. And there's some universities that specialize in food safety as well. So they could explore with those universities.
Yes, that's very good information. And then I think like my last question would be, for a young Chicagoan who unsure of what steps to take, where to go, looking for a different career path, what would be your advice to them?
Yes, so if my advice to them is, if this is interesting for them, to start off as a sanitarian too with the city of Chicago, the minimum requirement is an associate's degree, okay?
Good to know.
A lot of the staff have more than an associate's degree, but that's the minimum requirement with 9 hours of biological sciences. So if they are working in the restaurant industry, they may want to consider a job in food safety because they've done the work as an employee, as a kitchen manager, but there's some staff that may want to expand their career.
Yes.
So they may want to consider a job in food safety.
Good. Thank you again. I think that you've definitely highlighted and provided awareness about food inspection across the city of Chicago. So delighted to have you in the studio, as well as sharing the impact that you're making, as well as all of the women across the city of Chicago. Chicago, take the time to highlight and celebrate our women for Women's History Month. Again, thank you so much, Chicago. Have a wonderful day and stay safe. Bye-bye.
Thank you.